I remember I was so nervous to leave my first associateship.
Me too, bro. I cried. I cried. You cried too?
Yes.
Oh my God.
I remember I was so nervous to leave my first associateship.
Me too, bro. I cried. I
cried.
You cried too?
Yes.
Oh my God.
But let me tell you how I knew it was real, okay? Because I was like, they were pushing me so hard that I was like, oh, is this how folks like cut corners? And then I'm like, wait.
But you were peds at the time.
Yeah.
Okay. You never worked in between?
I did. I worked during residency. What is it called? Moonlight?
Moonlight, yeah. Okay.
Not moonshine. Moonlight.
Moonshine. No.
So I did that on the weekends. I was a hustler.
Yeah, me too.
Making my
I did that
my
too.
little chunk.
Yeah, I'm making $500 a day.
Yeah, it was nice.
It was nice. A little check or something.
I was like, I'm still in school.
Making money, yeah. But you were, different. But yeah.
I was still on student loans.
I was getting money. I was getting money twice.
So nice. You're getting the residency pay and a job.
Yeah.
I liked that though. Like I liked moonlighting.
Yeah, moonlighting was fun.
So when I was like, hold up, I'm compromising care for a patient. This is not like you can cut a corner like you didn't clean up the nail polish off of the cuticle. This is like
life or death. Well, not life or death, but like
someone's
life
quality of life.
Yeah, especially when they're so young.
Like traumatizing them if they move and I'm like I'm rushing and like I cut whatever.
Yeah.
And then I was like, oh, I think that's like my gut was telling me no, so I just followed it and I'm so glad I did.
Yeah.
Because
so the reason you left your first job was because
I was being overworked. I don't even know if I want to use that word. The reason I left my first associateship was because of the micromanaging. The micromanaging and the like hustle, like factory style type.
Drill and fill.
Yeah, and like for me, it's very important for me to bond with the child. So like the moment I sat down and I looked at my sister and I was like, what tooth? And versus being like, hey, Johnny, like let me make you feel like comfortable. And I was just like, let me sit open. Like I was like, ew, that's not who I want to be as a provider.
And it was your first. So the reason is to like, reason you left your first job, micromanaging, which looked like hella patients on your schedule.
And like, why are you doing
multiple
this?
columns.
Why are you doing that?
Oh, like they're asking you, like they're not giving you freedom in the treatment plan?
Yeah.
So they were
micromanaging.
Okay.
Yeah.
Well, I mean, just like tangible. So like somebody, because micromanaging can sound like you know in different models. So it'd be like, what would micromanaging look like in a dental office? Like for me, micromanaging, which was another associateship I left, not my first one. It was going through all of my treatment that I did for the month, and then being like, according to statistics. Statistics show that 30% of the population has periodontal disease. So you're based on your production, you need to be doing 30% SRP for your cleanings. And based on the population of this, you should also have X amount of crowns.
That's
and
crazy.
Also based on the doctors or associates that work for our office who have been working for 6 months or 7 months or a year have this many crowns, and this is where you fall. I said, I don't give a where I fall. Am I making money or am I not making money? Not in a sense of like producing, because I mean, that's what we're there for. Yeah. We're here to make a living. We're here to do treatment, but...
And we're not being negligent.
I'm not being negligent, and I'm not doing over treatment. I'm doing my job. I'm diagnosing what I see, and I'm doing it. So I don't know if the other people that are working with you need some sort of encouragement or need some sort of AI or some sort of like da-da-da-da, but I can see with my own eyes. I can read x-rays and I can do treatment.
Have you had an issue since? Like, am I...
So my micromanaging was that. So what did that look like for you?
It was, I think that the office had previously gotten audited for like 2 surface fillings, like OB or OLs, like chewing surface fillings.
Mm-hmm.
And I guess insurance was like, you guys aren't numbing for all of these.
So like PR
like,
residence type
are
shit.
you actually doing fillings?
Right.
And for me, they pulled me and my co-resident, who also we started at the same job, and they're like, you guys need to be numbing for all of these. And I'm like, actually, the more I can get away in pediatrics without
numbing is the goal.
the better. Like people.
Do you want to deal with crying patients?
People be doing class 2s on primary teeth without numbing because they just got the touch.
Yeah.
Who? I'm like, and I think that was like for sure their fault because they were notorious for overdoing.
Yeah. So now I have to deal with y'all BS.
Telling me how to do my treatment as like a new, and I'm like, okay, so like that is their issue because they were doing pulps on things that could be like a small surface white.
Yeah.
And so they had a bad rep with the insurance, and so then they came and put
now
that
they're
on
trying
me,
to like make do with you,
and then being like, you can do more, you can see more, and then like. I'm a very quality dentist. And it's crazy because...
That's where we're dual. That's where the dual comes in.
Anyway, so that was crazy, bro.
Yeah, that's crazy.
But I'm really happy. So what I learned from that was to follow my intuition.
Mm-hmm. When that gut started, I almost had to throw up yesterday.
I was like, I don't want to be this kind of dentist. I don't want to just...
No, for sure.
So that was
that was micromanaging, and then you said
micromanaging
and
just like
no, the other one you said
telling me like why I'm not treatment planning the way they wanted me to treat.
No, you said it was two things that made you leave your first job. It was micromanaging and
being overscheduled, like too many patients in the day. Like peds, it became normal to see 50 to 60.
Yeah, you be seeing hella patients. All them exams because they think you could do it so fast. Yeah. It's like,
listen, you can't. Right?
You can,
but if you want those, like, if you're putting me in a private office and you want me to make every single one of your patients feel good, I can get
and talk to parents
and look at the parents in the eyes and be like, your child needs to go under general anesthesia tomorrow. Like, they're like, what the? And I'm like, okay, like I have to sit here and talk about all the options. And some people can do it really well and I think something that owners don't necessarily, I mean, I don't know if they put paying attention to this, but if you hire an associate and they are dishing out the difficult conversations that you dish out with people who you have a good reputation with, you have to know that associate doesn't have credibility with the parents yet. Yeah. So it's going to take them a little bit longer to make the parent feel comfortable and welcome and
all the things.
Accept the treatment plan because you're gonna come to
because they have to do the treatment.
Why is this patient not returning for treatment?
Yeah.
Did you explain it to them well enough?
Yes.
No, because you gave me 2 minutes to tell them.
Period. And they don't think that they don't understand that like they just are pushing these models, like project models, because it's like
because they can do it. That's why
the corporatization of dentistry has created these project models that they think that they can push through, which basically makes the patient suffer and the provider. If you have a provider who cares about patient care and bedside manner and all this other stuff, but you think that you can now create a project model like it's a Walmart or a Target and use these KPIs and all this other stuff to now put on humans in like medicine, specifically dental, and it doesn't work.
I think it's because it goes off what you probably mentioned, that they just accepted the business model
that there's gonna be losses, like,
or the success of the treatment.
Yeah,
like they don't care if that patient comes back in 2 years because it's money to them.
It does nothing matters. It's all whatever.
It's just a crown, right? But it's whatever. Not that patient's quality of life. Them having to take work.
They don't care.
Like coming back in to get the shit done that the dentist who did it initially should have done it properly. Because why am I redoing teeth?
Can we talk about...
Why am I redoing a child's tooth?
Can we talk about the dentistry that we see that's done?
Y'all have to be super intentional about where you choose to go to dental school.
Can we talk about the dentistry that we see?
I get so upset seeing some of the dentistry.
Like, you just let this go.
You felt okay to be like, get up.
Okay, I'm going to give a caveat. Because the first couple years of my dentistry wasn't like...
But did you finish the restoration?
I honestly did the best I could. So I give grace sometimes But if I find out, like if I find, like that's my little like caveat. So
we give grace because we all have work that can
be done better.
Be done better, can fail just simply because of the patient
and it's
compliance.
dentistry is a practice.
So we get that. Like we all have redos.
Disclaimer, but
when I see a composite blobbed on, didn't
with
even
no,
use an instrument to pat it down.
Just.
I wish the thumb would have worked better because I don't know how it's extruding. It's like they just pushed on the tooth and cured it. They didn't even, like, if you put your thumb on it, it would have been smoother. And they just get up and go.
And they be trying to give me a hard time when I'm trying to tell them what they need.
Yeah. No.
So don't be a dentist if you don't care. Like, pick another career. Like, there are plenty of careers out here that you can make money and, like, feel good about yourself and go. Am I talking about a specific person? Make money or like travel, like whatever your desire is in life. You want to buy a Porsche. Like, I don't know why these people are doing this profession, whether it be ego driven or like whatever.
But if they don't care.
But like, if you don't care about your patients or like your work, or you don't have pride in the dentistry that you're doing, don't pick this career, because there's going to be somebody else who their patient is going to get in that chair, and now that patient is going to be having all the questions and all the anxiety or the trauma or the this or the that. And that's what people who actually care about their craft have to deal with, and then convert and like explain and spend the extra time and this for them to take care of themselves so they can keep their teeth in their mouth, because these people are I'm gonna say it like Paige. They're messing people over, and it's like I'm the one that has to clean up the mess.
Well, do you think that like those providers, do you think that like the pressure of corporate has impacted their quality of care by any means? Or
if you have integrity,
exactly.
That's the whole
like, stop overworking us.
That's the whole point. And like and then do what your heart desires. Like, do the dentistry that you want to do. Like you just literally said, like you found your portal. Like, I'm just gonna brag on Ashley. She went to obviously the process, right? You graduate from high school, you go to an undergraduate program, and you bust your ass to get into the dental school that you wanted to go to. And then you said, you know what? I want more. I have a passion for something that's living inside of me, and I want to work with children. Boom. I don't even care if I got to take out more loans to do it. Boom. Then you say, I'm out here working, and I can't do what I need to do for the people. And then you go back for more. And like, you're following your passion. And then you kept doing it. Now you working on the sickest of the sickest people, and right? And I'm in this elbow deep. Sorry.
This has many good qualities. Because those kids too, like, they never seen a dentist, and I have to know when I'm working on them.
I'll be texting Ash in the middle of the day like, hey, boo, how's your day?
I'm like, good, we gotta run, bye.
Hours later, like nobody's doing all that.
Really?
No, people. I mean, like they're doing it, but they're not doing it with the same like whatever. So that's what I'm saying. Like, this isn't the career that I think you should get into if you don't have a true passion for it.
Because you won't wake up in the morning.
Or corporate, or these people will push. Dentistry, I will personally feel like, is a profession where you can lose your integrity if you are not passionate about and don't have the integrity to maintain a baseline for your treatment or your quality of care. Because it can be a money grab. It can be this. It can be that. Easy. It can be that.
It's a fine line.
Yeah.
It's a fine line.
So don't do it.
Because you can easily.
But that's probably like an any profession too. But don't do it. We telling people don't do it. Yeah. Because that's not fair.
Just know to be.
Because you're working on people.
Working on people. That's how they eat.
Yeah.
Like, that's
literally.
How they, like,
function.
Yeah.
Quality of life. Like
pain,
all things.
You know, it's the number one reason why kids miss school.
Yes, it's the number one health disparities in children.
Yeah, number one childhood disease, 5 times more than asthma. So, try to give her a high five.